You're listening to the Public Rail Now podcast. As always, I'm your host, Adam. On this episode, I talk with Jami Wallace, an organizer and activist from East Palestine, Ohio, and the founder of the Chemically Impacted Communities Coalition. We discuss what happened in East Palestine, how people are still suffering from the impacts of the derailment, what folks are doing to fight back, as well as the concept of sacrifice zones and the UPNS merger and much more. To learn more about and get involved with the Chemically Impacted Communities Coalition, please visit CICC-solidarity.org. If you support the work we're doing with Public Rail Now, please consider making a donation or becoming a monthly sustainer for our campaign. I know times are tough, but every little bit helps us continue fighting the good fight. For more information about Public Rail Now, please visit publicrailnow.org. Thanks for listening.
My name is Jami Wallace, and I'm the founder of the Chemically Impacted Communities Coalition, which is CICC for short, CICC. I am a lifelong resident of East Palestine, Ohio, where the train derailed back in 2023. I knew right away that the EPA was not telling us the truth, that it was not safe to go back into our home. So I kind of raised a little ruckus and got the railroad down there to confirm that our home was not safe. That day kind of started my path towards advocacy and fighting for my community. I knew that they weren't just wrong about my house. They offered us money to get out, but we weren't going to take money and keep our mouth shut. I've had my mouth open ever since then, and I will continue this fight till the day I die, because I'm a mama bear, and mama bears fight for their children, to the death. And it doesn't matter if it's a grizzly bear or a home intruder. I'm going to fight Norfolk Southern and my government until the day I die, because they could have taken my child's life.
Yeah, Jami, thank you so much for being on the program. And I wanted to ask you first, if you could describe that day, because a lot of folks obviously have heard about the derailment in East Palestine, but what was that day like? How long did it take for folks to start feeling the effects? Like, was it apparent right away that it was as big of a disaster as we learned that it came to be later on?
It was apparent to some of us, but not to my husband. It wasn't really a typical day for us. Usually we don't get a whole lot of visitors. That day, my husband's best friend had come down to visit from Cleveland. They hadn't seen each other in about a year. He brought his son down because he's a single father. So I agreed to stay home and watch his friend's little boy and my daughter, and the guys were going to go out and have drinks. We were sitting there, me and the kids, and I was actually had one of them asleep and was trying to put the other one to sleep. And I heard sirens. And I was like, okay, something's going on. And then I kept hearing sirens and they didn't stop. So I called my mom and I'm like, what's going on? And she said there was a derailment, down on the tracks. And I was like, oh gosh. And she said, it sounds pretty bad. She told me where the derailment was, and it just happened to be behind the bar that my husband and his friend had gone to have drinks. The name of the bar is State Line because it's literally on the state line. You can put one foot in PA and one in Ohio. And that's important because PA gets left out of this. And when we say it happened near PA, it's not just, within a few miles, it's a stone throw, if that. So I called my husband and I said, train derailed down there. You need to get home. He said, oh, come on. I haven't been out with, Denny in a year, and you just don't want me out having drinks with my buddy. And I'm just like, whatever, 5 minutes later, he called me back and he said, we're on our way home. It looks like the gas station next door is going to explode. So he comes back home. By the time he got home, my mother had called again. No alerts over our telephones, anything of that nature. My mom called and said they're evacuating within a 1 mile zone of this derailment. My husband's friend and child headed back to Cleveland. I grabbed a bag for my daughter, threw some stuff in it, and we jumped in the car. We had no clue where we were going to go. It was the middle of winter. It was about, I'd say, around 11 o'clock at night. We were looking for a hotel. There was only one hotel in close proximity of East Palestine. And of course, it was full already. So people were having to travel quite a distance, to find a hotel. So my brother called and he said, hey, we got a room over here at the nearby hotel. He said, why don't you just come over here and stay? Because we really didn't have the money for a hotel room. So we thought it would just be for the night. So we went and crashed on his hotel room floor. When we woke up in the morning, we heard rumors that all of the roads into town were blocked, and that they were shutting down East Palestine.
Wow. And the initial response from, the public officials, the fire department, police, like, how's everybody getting like the information? Like, okay, it's time to evacuate. Were people knocking on doors, or I guess, like, yeah, how are they assisting people to address the situation?
I think near the derailment site, they, the closest proximity, I think they were going door to door, but there was no type of like emergency alert or anything of that nature. We didn't even know where to go for information. Most of it was just word of mouth, which is how, stuff usually travels around a small town. Afterwards, we discovered that our emergency evacuation plan for our community had not been updated since 1989. So that's one of the things, the reasons why I formed the CICC was because that's stuff that people should think about that we don't. We want to help prevent some of these disasters by just easy things we can do. I went after the derailment and canvassed in a nearby neighborhood. They had a plastics plant right there in their backyard, and there was no emergency evacuation plan in case something happened and it blew up, and it was so much more effective for me to be like, talk to them like they're a person. I'm not out there pushing politics or anything else. I'm saying, look, if something happens, you're going to wish you had an emergency evacuation plan, because the night it happened to us, it was complete chaos. I wished we had something like that so that we could be informed, so we knew what was going on. So, people don't want to take an hour or two out of their day because they have soccer practice or they need to cook dinner or they need to, and change starts on that local level. People need to start paying attention to what's around them and trying to push for the simple things that, can be life or death in a situation like East Palestine.
Wow. So it was really just members of the community really doing the heavy lifting, like telling everybody what's going on. And so there wasn't really, like you mentioned, there wasn't an evacuation process. It was all kind of like word of mouth and everybody trying to just do the best they can with the information they had.
And they told the people outside the 1 mile zone to shelter in place. Like the chemicals were going to go to the 1 mile zone and stop. We all know that chemicals just don't magically know a radius, and on top of that, we didn't know where to go for information after the initial derailment. Even like you said, word of mouth, we were hearing in the community that it was vinyl chloride on that train. But even when our mayor had press conferences, they would call it the chemical of concern. I know when the evacuation was lifted, I asked one of the scientists, well, what's in this creek that runs 10 steps in front of my front door? What all chemicals are in there? We don't even know. 3 days before that, they had just released more chemicals that were on this manifest. So we didn't even have the information of what we were being exposed to until it was too late.
Yeah, I mean, we know from the NTSB hearings and their findings that Norfolk Southern pushed for that vent and burn that was completely unnecessary, and that that mushroom cloud that everybody has seen in pictures. Yeah. So they weren't communicating any information. Norfolk Southern or anybody wasn't telling anybody about the vinyl chloride and all the carcinogenic materials and everything that was being released.
Hell no, they still don't. They still say everything's okay. Everything's fine, and the scary thing is right now, I know 17 people with cancer. I've never in my life known 17 people probably total in my life that have had cancer. If you're in a bigger city, that would be comparable to 17 people maybe in one city block. There's only 3,400 people in the community. So you can't tell me that those chemicals did not cause this. And as you were saying, oxyvinyl, the owners of the vinyl chloride were on site. And Norfolk Southern said the reason for the vent and burn was that one of the valves on a tanker of vinyl chloride was malfunctioning. And if they didn't do the vent and burn, it was going to explode on its own and it would throw shrapnel within a mile radius. And what oxyvinyl, the owners of the chemical, said was that was not true, that tanker actually was cooling down and was starting to plateau. Norfolk Southern never told any of the decision makers that. They said you have 13 minutes or this thing's going to blow. Not only did they lie to our fire chief, the decision maker, they lied to 2 state governors, they lied to State Highway Patrol and every other official that was in that room. Even Governor Shapiro wrote a letter after the vent and burn about the situation, and he said they acted like it was this joint command and they were all in one room. In actuality, Norfolk Southern, Norfolk Southern was off in another room by themselves. They had removed themselves from the bigger group, and they would come out with a decision, and they would tell them what to do. This has been a problem since day one. Norfolk Southern was put in charge of all this.
Wow. So it's like they're just, it's almost like they're a self-governing body, or like they just regulate themselves. They don't have to be accountable to anybody.
Well, and that was Governor DeWine's comment after NTSB, disclosed there was no reason. He said, well, none of the experts told me that. Well, who were your experts? Norfolk Southern. That's putting the fox in charge of the hen house, and they've been in charge of everything, that from, the vent and burn to the testing. How does that even make sense to anybody that they would be in charge of this, allegedly with EPA oversight? But, after this derailment happened, the vent and burn, what they actually do is they kind of poke holes on the side of the tankers and let these chemicals flow down into ditches. And then they set the ditches on fire. Everyone assumed all those chemicals had burned out, but there were still chemicals in that ditch. And if EPA was on scene within hours, actually 2 ditches, that's a whole nother part of the story. I could tell you so much. The EPA allowed Norfolk Southern to cover up both of those ditches with gravel. They still had chemicals in them, clean nothing up, and build their tracks over it. If EPA oversight, if they were there watching, how was Norfolk Southern able to do that? I mean, that's not me snatching something off your table real quick and you not seeing. That took days to do. So I question how much oversight there actually was.
Yeah, I mean, I've read some things about how the entire ecosystem of the area has been impacted, and even folks that aren't even necessarily in that area, like I can't remember exactly how many states were impacted, but it was something like, I think I read something like a third of the U.S. population in some form was exposed. 16 states.
16 states is the research that came out that those chemicals went to. And the first scientist that I met, independent scientist that talked to the community, his name was Stephen Lester. His name is Stephen Lester. He's from Love Canal, is where he got his expertise knowledge. He was the main dioxin expert for the state of New York. And what he told us, first of all, it was the first time we'd ever heard of dioxin. We're a small community. Nobody even knew what dioxin was or to even ask for it to be tested. And he told us that we needed to demand for dioxin testing. He also told us that the scope of this contamination would never be known. The government would never let it come out because it would cause mass economic hardships. And those trains do run through there. I mean, we have a train run through every 10 minutes. We have a north and a south track. That's a main thoroughway between the east and the west. So, of course, they wanted to get it back up and they wanted to get it opened at our, the expense of our lives and maybe yours, depending on where you are right now.
You had mentioned, folks having to evacuate or find a hotel. And like we were just discussing how it was kind of like done through word of mouth and people had to figure it out for themselves largely. So there was no guarantee of a shelter. People like had to drive for hours to find places. And how long were people how long did folks have to stay in those hotels? And I mean, are folks still unable to return home?
Oh yeah, I could never return home. They did set up an emergency shelter place, the high school, which ironically was in the 1 mile zone until the next day when they moved things about 0.6 miles closer to Pennsylvania. It took most of the populated community out of the 1 mile zone. And it also took that school that everyone sheltered in out of the 1 mile zone. But a lot of people were relocated to hotels. Norfolk Southern reimbursed us for our stay for a little over a year. And then they said they would no longer support people living in hotels. So people had to return to their homes, and a lot of them got sick when they had to return. The people that, when the evacuation was lifted, the mandatory evacuation was lifted after the vent and burn, as soon as people went home, they were getting covered in rashes and all these different issues that were going on with people. And that's why they did a voluntary evacuation after that voluntary relocation is what they called it, because trains can't travel through evacuated towns. So, some people that didn't have symptoms, because not everybody is sensitive to the chemicals, they thought they were safe too. And just because they don't have symptoms doesn't mean they won't have the long-term health effects. So some people were, living in hotels, eating out 3 times a day. Others that weren't sick were saying, oh, you're, milking the system and you guys are on vacation. I lived in a hotel room. It was me, my husband, my 3-year-old child, and my mother-in-law in one hotel room for a little over, I forget how long it was. It was like 7 months that we lived in this hotel, and it was no vacation. My 3-year-old being pent up in a room. Yeah, we had a pool, but how long was that entertaining for her in there playing by herself? Zero privacy. My husband and I were newlyweds. There was no privacy whatsoever. So fast forward to this class action that is a joke. Our own attorney screwed us, lied to us. Part of that lawsuit was that for property damage, people within the 1 to 2 mile zone would get $70,000 per household. And then it got lower as the distance went out. So I was in that 1 mile zone. So from my household of 4, that would have been like $17,500 a piece. But wait, all the money that we spent on living in a hotel, eating out, the transportation back and forth, that's all being deducted from that 70,000. So some people like me would have gotten zero. Some of the people that weren't sick said, well, why shouldn't they do that? You're double dipping. You're getting more than everyone else. Well, what if I told you had to spend your whole 70,000 on staying in hotels? You couldn't make your home safer. You couldn't move out, that you had to spend your money on these hotels, and I couldn't be in my home. After Norfolk Southern deemed it contaminated, we can never go back. We've never went back. We live still within probably not a safe distance away, probably about 15 miles away from East Palestine. But how do you move any further when all your family's there? It's hard.
Yeah, I mean, it's awful. And, I've heard stories. I remember even going, I was there at the high school when the NTSB was having their community meetings. And I remember people saying, like, exactly what you were just describing, how there are people that haven't been compensated at all. And then Norfolk Southern was sending lawyers into the town to try to convince people to take a rotten deal. I mean, it's just absolutely criminal.
Oh, it is. I mean, our own class action attorneys, first of all, I knew we were screwed with the class action attorneys after I had spoke to one of the attorneys on the case, and the lawsuit, since it was a class action, you had to opt in or opt out. And they had a date by which you had to opt out or you were automatically opted in. So that date was before the final NTSB hearing. So I called and I asked them, like, why would you want to settle before NTSB while everything's still contaminated? Like, it doesn't make sense. And the attorney said, this is supposed to be my attorney. He said, stop right there. I'm not going to listen to your conspiracy theory about Norfolk Southern's attorneys. They have your best interest at heart. Apparently, the guy didn't know who he was talking to. So I said, no, you're going to stop right there. First of all, I don't believe in conspiracy theories. And if they have our best interest at heart, then they're not very good attorneys. I mean, you always have your client's best interest at heart, not the opposing party. So these same attorneys, class action attorneys, actually held a town hall where they told everybody they, one, would be getting more money, which I'll explain in a second. And two, they had a toxicologist speak that said there'll be no long-term illnesses and no cancer from these chemicals we were exposed to. I literally looked him up on LinkedIn, and he worked for Chevron, Exxon, Dow Chemicals, and a couple of other major polluters. And back to the said we would get more money, they actually hired a PR company and started running these ads and this campaign to get people to sign up for the what they called voluntary exposure part of the lawsuit. Everyone else refers to it as personal injury. Originally, they had the same mile kind of approximate money you would get. You didn't know how much money you would get when you signed up because it was a pot of money. They gave $120 million for a 10-mile radius for the personal injury part. So depending on how many people signed up, was how much money you would get. So in the beginning, when they ran the information out through the community, it said you'd get approximately $10,000 if you lived within the 1 to 2 mile zone. And let me remind you, you're signing away all your rights, medical rights. So with this new PR campaign, they started running these campaigns and telling people they were going to get more money and they could get up to $25,000. That pot of money never grew. They changed the words. I mean, I can tell you, I'll give you approximately $10 and then say in the same breath, I'm going to give you up to 25 and I could give you $6 and that wouldn't, but make both of those statements true. But they led people to believe that they were getting more money so that they could get more clients to sign up. Our own attorneys hired a dioxin expert, Stephen Petty, to test some homes in East Palestine. And the homeowners were supposed to get the results, which they never did. And our own attorneys suppressed that toxicologist's information. It still is not allowed to be released. But they took this toxicologist that said, no cases of cancer and no long-term illness and broadcast that across the community. And right now we have people trying to get out of that because now they're really sick.
Yeah, and that was actually something I wanted to ask you about because, I mean, that's such an important point that even if at the time you might not have symptoms, things like cancers take time to develop. So, I hear stories all the time. There's people that have nosebleeds and skin conditions and all sorts of stuff that, it happened relatively quickly. But, if you sign away your rights, you could feel fine. And then one day, your prostate's the size of a bocce ball and you're not allowed to, you can't say, hey, Norfolk Southern's responsible for this.
And that's what we're seeing already. I knew that the cancers and stuff would come. I mean, we can look at every other chemical disaster. Like some of the cancers are just now coming out from 9/11. And I knew it was going to come, but I didn't think it was going to come this quick. We're seeing a lot of brain cancer, a lot of lung cancer, a lot of pancreatic cancer, kidney cancer, all the things that you would expect from chemicals. The problem with proving beyond a reasonable doubt is that there's a gap in the research. That you always hear the experts talk about, it's below the reportable limit for vinyl chloride. Basically they do these tests to see how much vinyl chloride it's safe to be in. But when they do those tests, they only expose that subject to that one single chemical. There's no research on what happens if you're exposed to 50 different chemicals and they're all right below that reportable limit. There's zero research. But, in the civil case, it's only beyond the preponderance of the evidence. And if you look at every past disaster and you look at what's happened to us, I think it's undeniable. I'm old, fat, overweight, smoke. I developed really bad asthma. I have to actually go see a pulmonologist. Never had breathing problems before the derailment. Even though I was all those things, I could walk 3 miles back to my favorite fishing spot and never be out of breath. Now I can't walk to my car. Okay, maybe it's all those things catching up with me. I admit I don't live a healthy lifestyle. But when you look at 300 other people in the community have developed asthma too, how do you deny that big plume, that mushroom cloud, looked like an atomic bomb was dropped on us, that doesn't impact the reasons for having asthma now at almost 50?
Yeah, and I think it's important for people to understand as well, in addition to the lawyers that corporations hire, like, of course, they're going to have the corporation's interest in mind. And it's the same thing with academics, too. Like, they can pay off scientists and say, oh, no, it's fine. Right. Like, so a lot of the, even if there are these studies coming out, it's like you're describing, like, they're not accurately depicting what has happened to folks.
The one thing that I realized is that you can manipulate data. Like, early on, we were getting these readings of our house that were the EPA was putting out less than. It was less than that or less than this, but they weren't saying what the actual numbers were. So again, what if all of them were, 0.001 off from what the reportable level was? But I say the advice that I give to other communities when I'm doing my work for CICC is ask the scientist how the study will help you as a community. Because so many of these scientists want to come in and study you so that they can publish some data in a book. I've been working with Dr. Beatrice Gollum from the University of California, San Diego. She actually worked at the VA when our vets were coming home from the Gulf War. And she's also she's a researcher and a medical doctor. So the VA was telling all the doctors, give them psych meds, which is what they tried to convince us we weren't sick, we were crazy. So she did research, and she actually has gotten the PACT Act for our military veterans of the Gulf War. And most recently, and this Gulf War was 1991? They just now got a medical code in October of 2025. Dr. Gollum led that push to get a medical code for Gulf War illness and to get it recognized. For the past how many years they've been facing the same thing that we're facing in East Palestine right now, are doctors that are clueless. They don't know anything about chemical exposure. Doctors that in our area, were told by the CDC not to test us for chemicals and not to give us chemical diagnoses. Why? Especially when the CDC came in to go door to door, they were there not even a full day and half their staff got sick. They went back to DC and never told us. We found that out through a FOIA request. But yet they were telling our doctors not to test us. So, when it comes to research, I think it's finding the right researcher. I can tell you from the case study that Dr. Gollum did, which was just one resident, the bigger study in our community is still going on, that it's called Echoes of Gulf War Illness. She's comparing our symptom profiles to those of the Gulf War veterans. Like I just said, we can look at past chemical disasters. We sometimes overlook our vets, but that was one of the biggest chemical disasters, in our history, is when those men and women were exposed to those chemicals while serving our country. So, the fact she's taken that symptom profile and comparing it to ours, and again, we're seeing all the same illnesses. It's not like I Googled, what kind of symptoms do you get from chemicals? And then I was like, oh, yeah, well, I have hypothyroidism now. I've been diagnosed with hypothyroidism. I've never had an issue with my thyroid, but we know that chemicals often attacks the thyroid right away. Again, if it were just me, okay, maybe it's a coincidence. But, I can name 5 people right now that have either had thyroid cancer or had issues with their thyroid as far as like thyroid disease. And there's a lot more. Those are just the ones I can name off the top of my head. So make sure the research is going to do something for the community.
I mean, that seems like a huge cover up. I mean, I haven't seen. You would think that would be a massive news story that the doctors are being told to not test for chemicals in their prescribing psych medication instead of like trying to, like you said, say, oh, you're not actually feeling these symptoms. It's a
Well,
mental
it
thing. I
was
mean,
here. It was so bad that we recorded a video of my brother, and he went into our local doctor's office right there in East Palestine, the only one we have, and he said, "Hey, I want to be tested for vinyl chloride." And the doctor would have to write up the prescription, and then you have to go to nearby city that has a Quest lab and get the test. Doctor said, "Nope, CDC told us not to test you." And my brother's like, "So you won't write it up for me to get tested for vinyl chloride?" No. Their excuse was it was like 5 months out, and that vinyl chloride only stays in your system for, I forget, hours or days, whatever. Couldn't possibly still be there. But people that did get the test were testing high because we were still being exposed. So a local chiropractor who also lives in East Palestine, Dr. Chai, he's been a huge advocate, done so much for the community, walked the creeks and, risk his own health to keep us informed. But he was like, if you're one of my clients, I can write prescriptions for blood tests. And he figured out what the codes were. And he started writing people prescriptions that were his patients to go to Quest and get this blood work done. So a few people got that done. And then Quest Labs all of a sudden quit doing the testing. And you couldn't make this stuff up. And again, I know I keep bringing up CICC, but this is one of the reasons why I formed CICC, to support other communities, because it's almost like when you take a person like me that was very practical, if I heard somebody saying some of the things that I'm saying right now pre-derailment, I would say, get this crazy lady away from me. She's a conspiracy theorist. She's talking about EPA cover-ups and the government being owned by the railroad. But this is a reality. It shattered everything I thought my country was. And when you think there's no way in hell the CDC came in and got sick and left and now won't let us be tested, and then you call someone that you met that was an advocate during the BP oil spill, and they say, oh, they're still doing that. It makes you realize you're not crazy, because you begin to think that you're crazy. This couldn't possibly be our government that's leaving us here to die.
Something I wanted to bring up, because we were both in DC for the East Palestine Bhopal Solidarity event. I think it was a couple years ago. And the concept of sacrifice zones. So basically anywhere where there are folks who are working class or, low income, they're basically just written off as spaces where, well, destroying these people's lives is just the cost of doing business. And, bringing up the Gulf oil spill and all these other disasters that have impacted folks across the country and, all over the world. I mean, what does it mean for communities like East Palestine to basically be written off as places where, whatever happens, it's just the cost of doing business?
Well, I guess, I wasn't into any type of environmental advocacy before this. And the first time I heard sacrifice zone, I was like, what's that? I didn't even know I lived in a sacrifice zone. And I think what it is when you grow up with all this pollution around you, when you grow up, with this plastic plant less than 15 miles from East Palestine, shipping port right there on the river, all this stuff around you, Hermitage Thermal, that's a hazardous waste incinerator, and it sits right in the middle of a residential area. They took a lot of the soil from East Palestine there, and it's less than 15 minutes away. You don't really notice it because it's always part of your landscape. And it's not until we open our eyes and see what they're doing to us. They make false promises when they bring these companies in. Oh, well, we're going to bring jobs to the area. Well, hell yeah. If somebody is trying to support their family and you're bringing jobs, you're willing to do any kind of work. In reality, most of the people in these communities don't get those jobs. And again, even the ones that do, it's preying on people that are just trying to survive. The perfect example is my stepdad. He's been in construction, retired as a union bricklayer. But when he was young, they said, we'll pay you $60 an hour to go into this place and remove this asbestos. No PPE, but what, 22-year-old that has a family that gets offered $60 an hour, you still think you're invincible at that age. He was willing to put his life at risk in order to make sure his family survived. So they really prey on people that don't have money. The same thing with the settlement. They thought, oh, we'll give a bunch of hillbillies $1,000 each and they'll be happy. They thought they were walking into this, this poor community that was uneducated. And we are, we're a poor, uneducated community, but what they underestimated was those old school morals and values that our grandmas gave us sitting on the front porch. And what that is that our land is important to us and our family is important to us. I'll fight to the death for my child. Like I said, that's what they didn't realize. That's what Norfolk and the EPA underestimated about East Palestine, was that we'll fight for our families. We'll fight for our land.
Absolutely. And I wanted to ask is because there's all this stuff in the news right now about Union Pacific and Norfolk Southern merging. And I can imagine in a town like East Palestine that had just recently, a few years ago, had this absolute disaster happen as a result of Norfolk Southern's, and I mean, all the Class 1 railroads do, though. We just want longer and longer trains, heavier and heavier trains, all more likely to derail. What kinds of discussions or anything, what's going on in East Palestine, anything surrounding like the Union Pacific Norfolk Southern merger? I'd be interested to hear.
People obviously aren't happy about it. But I think it should raise a lot of concerns for people in general, not just the people in East Palestine. We had one Unity Council member from Cleveland, and she said, I was sitting there watching an interview with one of you guys with, your kid talking about what happened in East Palestine as I'm watching the television with my 3-year-old listening to a train go through in the background. These trains run all through communities all across the United States. And it's almost like, Norfolk Southern obviously already has so much power that they control our government. So let's just give them some more power and some more money and a more way to monopolize. It's not a good thing. And it also scares me legally. What kind of rights are they taking away from our children? A lot of us have not signed our children up for lawsuits because we don't know what's going to happen. That's a decision. That's an option I want my daughter to still have when she's 18 years old, if she's still here. So what does that do for the lawsuit? And it takes me back to that conversation with Bhopal. They said that, that Urban Carbide, who was the owners of the building that exploded over there and caused their disaster, sold right after that to Dow Chemicals. And what Dow Chemicals said is, hey, we absorb all your assets, but not your liabilities. Could Norfolk Southern do that if they merge with CSX? I just find it to be real funny, that this is happening now after this major disaster. And it's not fair to the rail workers either. Let's talk about that. I'd never heard of precision scheduling before this. And actually, at one of the conferences I went to with the union, I was talking to an old timer, an old train conductor, and he said, look, we know how to do it safely. They don't let us do it. He said back in the day, he was talking about before he became a conductor, he had to basically be like an apprentice for 4 years on someone else's train. The person driving this train in East Palestine had been on the job for 18 months, had their own train, and was training someone else. We know how to do it safely. And, I know a lot of people are ban vinyl chloride and do this. And, I honestly think that we've become too dependent on it. And this is just my opinion, that it's going to be really hard to do. And I do believe that we should eventually do it. But what is easier and what we can do now is change some of these safety regulations, make sure that we don't have one person on a train, make sure that they're not making these trains so long that, one person can't reasonably control it all. Those are the things we can do now. And if we don't pay attention and fight, this could be anyone, and it will happen again.
Definitely. And that's something I always like to remind people of is, yeah, it was absolutely catastrophic what happened. And it's going to happen again if we don't do something about it. And
Right.
so I wanted to ask you about, your work with CICC, anything going on, like just, yeah, what does that work look like? And I have been in communication with you for a little while. So I'm really, interested to hear how that's going and what kind of things you're doing to help people in these
Right.
communities.
So, like I said, after East Palestine, and well, not after it, it's still going on, but because of East Palestine, I saw, this huge problem. And it's not just East Palestine's problem, it's so much bigger than that. There's so many communities that are contaminated across the United States. And the thing that I saw that was missing was that voice from the community, that guidance on how to fight yourself. Because I realized nobody else is going to fight for you. You have to do it. So when I formed this Chemically Impacted Communities Coalition, it was kind of for three things. One, like I kind of mentioned, prevention. There are little things that we can do. Having that emergency evacuation plan in place, making sure that your firefighters are trained in hazmat, but this encompasses all different kinds of disasters. So we can offer that information because we lived this experience. The second thing is to kind of have a one-stop shop for communities. I had no clue how to get a hold of a scientist or a major nonprofit or even you. We met by chance. So we want to take all of those resources and be able to offer those to other communities so that they don't have to learn the hard way, the way that we did. And the third thing is, to fight for systemic change. When we support the Railway Safety Act, having East Palestine support it is great, but having 500 different communities support it is even stronger. So right now we are trying to build our coalition. We've been adding new communities every day. We have about 34 communities right now that are part of this coalition. We also just got a fiscal sponsor, so we're starting our fundraising so that we can do more. Thus far, we've been supported by other nonprofits who have given us small grants. But a lot of what we've done thus far is go into communities when these disasters happen and support them. Not take on the fight for them because we couldn't do that, but teach them how to fight. Teach them that they can't trust the EPA. All these things that, again, we learned the hard way, we want to take to these communities. We went down and actually on the 40th anniversary of the Bhopal accident, we welcomed Conyers, Georgia to our coalition. A lot of people don't know what happened there because it happened at the same time the hurricanes were hitting the Carolinas, so they didn't get a lot of press. But they had a biolabs, it was called, that blew up. They produced and manufactured and stored swimming pool chemicals, seeing all the same issues in this community that we saw in East Palestine. We went into Conyers, and then we went to Moss Landing, California. They had a lithium battery plant catch on fire that kept reigniting and poisoned them. Most recently, we went into Roseland, Louisiana. They had a oil plant explode, and all the same symptoms, all the same issues, and what we took with us was dependent on what the community wanted. What we always did was a panel, one of other people from across the country like myself that could offer support and words of wisdom. We have a panel of professionals on human health, which, would include Dr. Gollum. We would have a panel on the what I call the doctors of the environment, the scientists, so we tried to bring in information with us, and then we'd also bring in tangible things depending on the community need. For example, Roseland, Louisiana is very focused on detoxing their bodies and remediation. So we took some different house plants that could detox the air in your house. We, talked about how you can detox with, Epsom salts to your body, or, activated charcoal you can hang in your car to help detox the air in there. So, depending on what the community wants. Again, that's what I saw was missing from a lot of these big nonprofits. They sent East Palestine gas masks, and nobody in East Palestine was wearing a gas mask, but we desperately needed water. So we've just been building that coalition. So we're looking for new communities that have been impacted by chemicals to join. And we're also looking for response partners. And these are people, organizations that have helped us during our chemical disaster in other communities, and just simply allowing us to put you on our page as a resource. So when these communities start their fight, if it's, say, another train derailment, then Public Rail Now is one of our response partners. So they could go on our page and be like, oh, this organization has to do with railroads. Let me get a hold of them and see how they can support our community. So if anyone out there listening thinks that they would like to be a response partner, let me know. I can give my contact information. Or if you're a community that has been impacted by chemicals and you want to join the bigger fight, get a hold of me. And if you want to fund our communities, get a hold of me.
Yeah, just incredible work. I mean, I can't say enough about, everything that you're doing. And I mean, it's just critical that folks get involved. So like we've been saying, this stuff's going to keep happening if we don't do something about it. And it's going to take all of us working together and fighting this thing. So, and I also wanted to ask about, you recently sent me an update about there's the case between the state of Ohio and Norfolk Southern. Yeah. And it looks like it's kind of going in East Palestine's favor. So I'd love to hear more about that update.
Exactly. So there's actually a couple of big developments in the past 2 days that have given us hope again in East Palestine. One of them was our attorneys with Keenan Law filed a motion to intervene in the state of Ohio case, which impacts the federal consent decree. And basically what that means is now the people have a voice at the table. For the first time in any court proceeding, we are going to be heard. Instead of it just being the EPA and the state of Ohio sitting there negotiating, we've showed that we have enough evidence and we have enough interest in the case that we can intervene. So that puts our attorney at the table, which is huge. I mean, we could get the relocation we've been begging for. We could get health insurance. Like, we still don't have health insurance. And then the second big win that I just found out about right before this podcast is that in our personal lawsuits, again, there was a class action. People like myself opted out. And again, we also have some people that joined us that had signed up for that personal injury part and are now really sick and they want out. So, there was a whole list of defendants in this case because we're suing everyone from the local government to the EPA. Anybody that had any hand in this cover up, we're suing. And there were 18 of those entities that filed motions to dismiss, basically saying that they shouldn't be being sued. All 18 of those motions to dismiss were denied. So we will have our day in court with every one of the defendants that we filed against. When we've been a community that has felt abandoned, overlooked, when we're still here sick and suffering and nobody's talking about it, those are big wins for us. Just having our voices heard. A lot of us don't care about the money. Yeah, they owe us something monetarily, definitely do. Do I care if I ever get it? No. But what I care about is justice and accountability and the truth. Because if the truth isn't out there, they're going to dupe every one of you the same way that they duped us when something happens in your community. And it's not a matter of if, it's a matter of when another one of these disasters will happen.
Absolutely, 100%. And I want to thank you again so much for coming on the program. But before I let you go, where can people go to learn more, just even like if they haven't read up enough on what happened in East Palestine, and where can they go to track those updates that we've been talking about? And how can folks get involved with the work you do with CICC?
Well, CICC has a website. It's CICC, CICC-solidarity.org. We are also on Facebook. If you would like to get involved in the human health part of it, you can look up Dr. Gollum, Golomb, and she's at the University of California, San Diego. That would really help us, with the research side of it. If you just want updates on East Palestine, you can follow me on Facebook. I usually post every single update there is. And my name on Facebook is Jami Ray Wallace, Jami, no E, Ray, Rae, Wallace, Wallace. Feel free to message me. I check all my messages, any information you want. I have a public folder of shared information that I can give to you. So just reach out, please spread awareness. If everybody listening to this just tells one other person what's happening to us here in East Palestine, we might finally get the help that we need.
Great. Thank you so much again.
No, thank you. I appreciate you spreading the awareness. Hashtag journalists save lives. In all honesty, I want to say something about journalists real quick, if I can. It was kind of, I would tell all the journalists that came to East Palestine, hashtag journalists save lives. I'm like, without awareness, we're left for dead. And actually in the judge's motion to intervene, when they granted that, he talked about News Nation. He talked about reading, newspapers and seeing all this stuff coming out about East Palestine, but yet neither party had it in their discovery. So I guess I'm really, really smart because I know that journalists save lives. So keep doing what you're doing. And, again, I can't thank you enough for spreading awareness for East Palestine.